Have you ever thought you were doing something good by cleaning out your ears? Maybe you've used a cotton bud, ear vacuum, or even an ear candle. We'll be honest, it can feel satisfying. You hear a little pop, see some wax, and think, that's done. But here's the catch. Your ears are actually self-cleaning. And in most cases, trying to clean them only makes things worse. Today, I'm Dr. Calvin Prescott, earwax removal doctor. In part 1 of this series, we're exposing that big misconception. Trying to clean your ears often does more harm than good. We'll look at what people believe, what actually happens, and why clean ears may be a myth. Many of us have grown up believing that earwax is dirty and needs to be removed regularly, that skipping a week or even a day is unclean. So we reach for a cotton bud or a Q-tip, carefully swabbing inside. Others have tried clever gadgets sold online like ear vacuums, curette tools with cameras, or even ear candles that claim to suck wax out. These techniques are marketed as clever hygiene tricks, sometimes even labeled ear spa or home grooming. But doctors have been warning against this for years. Cotton bud use is a common cause of ear canal damage. A U.S. study found more than 263,000 children under 18 visited emergency departments over 20 years, between 1990 and 2010, due to cotton bud injuries in their ears. That's over 12,500 visits per year, or around 34 kids every day. Most injuries happened when children were cleaning their own ears, about 77% of cases. In these cases, the most common problems included foreign body sensation, nearly 40%, bleeding, ruptured eardrums, about 25%, or soft tissue damage in the canal. Even though most kids went home the same day, some suffered permanent hearing loss, dizziness, or balance issues. These injuries are far more common than most of us think. It's not just kids. Adults show up in the ER too, after getting overenthusiastic with cotton buds or sharp objects. Reuters reported roughly 36 children per day treated in the U.S. alone for cotton bud-related ear injuries. Practitioners remind us, never insert anything smaller than your elbow into the ear canal. Ear candles are another big warning flag. Some people still use these hollow cones, stand them in the ear, and light the end. They believe it creates suction that pulls out wax. But studies show there is no suction strong enough to remove wax, and the dark residue in the candle is just burned wax from the candle itself. Worse, they carry real danger: burns, ear canal blockages, perforated eardrums. Most health authorities are clear. Ear candling is unsafe and ineffective. Another trend: home ear vacuums and video curette kits. These look high-tech and satisfying. You see wax get sucked or scooped out on your own phone screen. But most users aren't trained to judge canal depth, handle tools, or understand the delicate anatomy inside. One mislocated scoop, and you could scratch the canal skin, push wax deeper, or even puncture the eardrum. So why do these injuries happen so often? Because we think we should clean our ears. It feels good, seems hygienic, and is heavily marketed. But it's more complicated than that. Repairing that canal, or worse, mending a perforated eardrum, can be far more painful and costly than simply leaving it alone. What actually happens inside your ear? Earwax, or cerumen, is created by glands in the outer part of your ear canal. It's made of a mix of shed skin cells, oils, and a little cholesterol. Wax is sticky. It traps dirt, dust, even small insects, preventing them from reaching the delicate eardrum. Here's the clever part. Your ear is self-cleaning. The skin lining the canal moves outward, and this motion is supported by jaw movements like chewing, talking, yawning. This process gently pushes wax and trapped particles out toward the ear opening. Once near the surface, wax usually flakes off or washes away under the shower. That means, unless there's a problem, your ears are doing their job, and they do it pretty well. Studies report wax migration works for 99% of people without blocks. So if your ears feel fine, no pain, No itch, no muffled hearing, just leave them alone. Wondering why wax seems visible? That's normal too. Wax can vary from pale gray and flaky to dark yellow or brown, and all are healthy variations. So if we try too hard to get rid of it, what really happens? First, digging with cotton buds tends to push wax deeper into the canal, compacting it near the eardrum. That can block hearing, cause discomfort, or make wax harder to remove later. Second, small tools or buds can scratch or nick the canal skin, an invitation for infection and irritation. Remember that otitis externa, or swimmer's ear, often starts when the canal skin is broken or scratched by these practices. Third, overcleaning can dry out canal skin. That layer needs wax to stay moisturized. Without it, the canal becomes itchy, red, and uncomfortable. You may feel the urge to scratch, leading back to tools, injury, and infection. Fourth, serious cases of perforated eardrums are not rare. A quarter of cotton bud injuries in kids involved ruptured eardrums. That's painful and may need medical treatment or even surgery. So why do we keep doing it? It's a mix of habit, marketing, and misunderstanding. Cotton buds are sold as hygiene products. Ear candles and gadget kits make it look like a self-care ritual. But turning it into modern self-care doesn't make it safe. In fact, it may be harming more than fixing. Meanwhile, doctors emphasize doing nothing unless symptoms appear. The American Academy of Otolaryngology recommends not routinely removing earwax if the ear functions normally. Instead, clean only the outer ear with a warm washcloth and let nature take care of the rest. This message is tricky for viewers. It goes against intuition. We feel like cleaning is good, but often it's just unnecessary interference. Earwax is made by specialized glands in the outer third of the ear canal. These glands produce oils and combine with shed skin cells, hair, cholesterol, and fats like squalene. That mix forms cerumen, a substance that's waxy in texture but far more complex than it sounds. This mixture performs 4 key roles: trapping dust, pollen, insects, and debris, lubricating and protecting the delicate skin inside the canal, maintaining an acidic environment that discourages unwanted microbes, acting as an antimicrobial barrier, rich in peptides that kill germs. Let's explore each. A sticky trap for dust and debris. Earwax's first task is mechanical. Its sticky nature captures dust, airborne particles, and even tiny insects. Once these are trapped, the skin inside the canal, which is constantly shedding, moves outward like a conveyor belt and carries the wax and debris with it. This migration starts at the eardrum and heads toward the ear opening, often aided by chewing or moving your jaw. Over time, the wax flakes off or washes away in the shower. In fact, studies suggest that this self-cleaning mechanism works for 99% of people with no blockages. Keeping skin healthy and moist earwax also moisturizes the skin lining your ear. Without it, that skin can become dry, itchy, irritated, even cracked. The natural lipids and oils in cerumen act like a protective lotion, keeping it supple and resistant to damage. If you strip away this wax by over-cleaning or using harsh methods, you risk creating dry, inflamed skin that's vulnerable to infection, building an acidic shield. Cerumen maintains a mildly acidic pH, around 6.1. Many bacteria and fungi struggle to survive in this environment, which keeps them from colonizing the ear canal. Without this acidity, the ear's warm, dark canal would become a perfect breeding ground for organisms that cause infections like swimmer's ear, otitis externa. Deploying antimicrobial peptides. Here's where things get really impressive. Earwax contains a cocktail of antimicrobial peptides, tiny proteins that act like bodyguards, destroying harmful bacteria and fungi. A 2011 study found 10 key peptides in human cerumen, including beta-defensins, HBD1-3, LL37, lactoferrin, BPI, HNP13, and others. These aren't just floaters. They actively neutralize microbes. Lab tests show cerumen can kill or inhibit common pathogens like Staphylococcus aureus, E. coli, Pseudomonas aeruginosa, Haemophilus influenzae, and Candida albicans, sometimes eliminating more than 99% of them. Research also highlights that cerumen is effective against Pseudomonas and E. coli, bacteria often responsible for serious ear infections and even meningitis in rare cases. Beyond these, proteomic analyses have identified thousands of other proteins and peptides unique to earwax, many linked to immune response and inflammation control. This isn't just a barrier, it's a tiny, heavily armed fortress working inside your ear. Why all this matters? Because earwax is doing so much. Cleaning it out unnecessarily removes its protective features. You wipe out its lubricating layers, lower its acidity, and strip away those antimicrobial peptides. That can leave the ear canal dry, irritated, and prone to infection. When the skin becomes inflamed or cracked, it becomes a door for bacteria or fungi to invade. This is what leads to conditions like swimmer's ear. Even worse, overcleaning can push debris deeper, cause blockage, create pressure, and even lead to hearing loss. And of course, the most serious DIY misadventures, like perforating the eardrum, can happen when people dig too deep, too often. Real-world insights. Doctors from UT Physicians describe how earwax traps small insects and prevents them from causing infections. Insects trying to crawl inside the ear usually get stuck in the wax and don't make it to sensitive areas like the eardrum. They also warn that we only need to clean the outer ear with a damp cloth. Never stick anything inside. Most people heal naturally, and earwax does the heavy lifting in keeping ears clean and healthy. When natural cleaning might not work, that said, not all ear canals are the same. In some cases, due to narrow canals, genetic factors, or conditions like Down syndrome, natural earwax migration can be disrupted. This can cause wax to build up and compact, leading to pressure, discomfort, or even bone erosion in extreme cases. That's why some people need regular checkups to manage buildup under medical supervision. The bottom line, earwax is far more than a waste product. It's a sticky trap for debris and insects, a moisturizer for canal skin, an acid shield to inhibit microbial growth, a chemical defense system loaded with antimicrobial peptides. That's why premature or aggressive removal can do more harm than good. How do you know when earwax has become a problem? Most of the time, earwax handles itself. But sometimes it builds up and becomes impacted, meaning it's blocking the canal and causing issues. Impacted wax affects up to 6% of adults in the UK, and a similar proportion in other countries, making it a fairly common concern. Here are some red flags: muffled hearing or a reduction in volume, fullness or pressure in the ear, earache or discomfort, ringing, tinnitus, or buzzing sounds, dizziness, or a sense of imbalance, coughing, thanks to the canal's connection to the vagus nerve ear discharge, often a sign of infection. If you experience any of these symptoms, earwax might be the culprit, or a more serious issue. So let's explore how to proceed. What you can do safely at home. When symptoms are mild and your eardrum is intact, it's often safe to try these home methods. 1. Softening drops, serum analytics. These are over-the-counter solutions, oil-based, olive, almond, mineral, water-based, saline, or peroxide-based, carbamide, hydrogen peroxide. Clinical guidelines recommend using drops twice daily for 3 to 5 days to soften wax. A Cochrane review found that any of these drops are modestly effective, improving wax clearance from 5% without treatment to about 20% with drops. Side effects are rare and usually mild: itching, minor discomfort, or temporary hearing change. If you have a perforated eardrum, ear infection, or recent ear surgery, avoid peroxide drops. Consult a professional before use. 2. Warm water irrigation. Once wax is softened, gentle irrigation can help flush it out. Use distilled or sterile water warmed to body temperature and a rubber bulb syringe. Tilt your head and gently introduce the stream along the canal wall. Don't aim straight at the eardrum. If you feel pain or pressure, stop immediately. Dry the ear afterward. Tilt your head and gently dab with a soft towel. Never irrigate if you have had ear surgery, frequent infections, a perforated eardrum, or use hearing aids without professional guidance. What not to do. Cotton buds or Q-tips only push wax deeper, compact it, and often cause canal injury or eardrum rupture. Ear candles are not only ineffective, they can cause burns, blockages, and even perforations. Home vacuums or video curettes may seem high-tech, but without proper skill, they can scratch the canal, push wax deeper, or damage the eardrum. When to see a professional. If symptoms persist after home treatment, or if you fall into specific risk categories, it's time to seek trained help. A primary care doctor, audiologist, or ear, nose, and throat (ENT) specialist can safely evaluate and remove wax. Here's when to get professional assistance: persistent hearing loss, pain, fullness, tinnitus, dizziness, or discharge. Use of hearing aids, earbuds, or swim plugs. Past ear surgery, perforated eardrum, or frequent infections. Home methods haven't cleared the blockage after a week. Professional removal methods. When you visit a clinic, here's what you might experience. Microsuction. This is often seen as the safest, most precise method. A specialist uses a low-pressure suction wand alongside a microscope or endoscope to gently extract wax. It's quick, minutes per ear depending on wax buildup. It's dry, no liquid, so minimal infection risk. It's precise, under direct vision, reducing risk of canal trauma. Some users report noise, brief discomfort, or mild dizziness, but studies show side effects are usually mild and temporary. Complications like skin injury, 5%, or eardrum damage, 0.01%, are rare. Microsuction details performed seated or lying down, under microscope or endoscope. Wax is sucked out with a fine probe, sometimes assisted by curettes for stubborn wax. Prices vary, but it's cost-effective considering safety and precision. Manual removal. Clinicians may use curettes or forceps under direct vision. Effective for specific wax types, but requires steady technique. It can be combined with microsuction. Clinical irrigation performed after wax softening. Professionals use calibrated syringing devices and ensure safe water flow and temperature. Used widely, but carries some risk, especially if the technique isn't correct. Potential side effects include infection, eardrum perforation, vertigo, and mild pain. How often should you have professional cleaning? If wax buildup is occasional, once every few years is enough. But if you frequently wear hearing devices, have narrow canals, or produce lots of wax naturally, An appointment every 6 to 12 months may be helpful. During the visit, your clinician can offer personalized advice based on your ear anatomy, wax type, work environment, and other factors. Your smart ear care routine. Here's a quick home care checklist. Trust natural ear cleansing. Don't clean unless symptoms appear. Use drops and/or irrigation carefully if symptoms occur. Avoid cotton buds, candles, vacuums, and at-home curettes. See a professional for persistent symptoms, ear surgery history, infection, or hearing devices. After clearance, maintain ear hygiene with safe habits. Avoid earbuds, use drops if needed, and protect ears in dusty environments. Earwax is often misunderstood, but a little knowledge can go a long way. In most cases, your ears are self-cleaning, and home care with drops and occasional irrigation is enough. When things don't resolve, professionals can help with safe techniques like microsuction or manual removal. Thanks for joining this series. Your ears do a lot behind the scenes. If you found this helpful, please like, subscribe, and share. It helps more people care for their ears the right way. Drop any questions or concerns in the comments. I'm here to help. I'm Dr. Calvin Prescott. Take care and trust your ears. They're smarter than you think.